All right, so moving on. Titled Robotic Rehabilitation from the Therapist's Point of View is the next contribution by Philippe Mariën, a Belgian physiotherapist.
Terapevt o dokazih uspešnosti nevrorehabilitacije je naslov prispevka fizioterapevta Philippa Mariена, prihaja iz Belgije.
Oh, good afternoon, everybody. So let me quickly introduce myself, why I'm here. I am a clinical applications manager for Hokoma, or DIH Technologies, which means that the main part of my job is actually trying to help with implementation of these robotic devices in clinical and hospital settings. Now, I was asked here today to speak not for the part of clinical applications manager, but more for my part of physiotherapist, actually. So about 8 years ago, I graduated as a physiotherapist in Belgium, specialized in neurological rehabilitation. And it was quite quickly that I discovered that although you can have some amazing results with your patients with traditional therapy, this usually took a lot of time and a lot of effort. So that's when I started to look for more new technologies to see if there was something else that I could even improve my patients more than with the traditional therapies. And this is how I ended up using these robotics. So I used to work at a private clinic in Belgium, where the main focus was treating neurological patients with the use of these robotics. And now I would like to present to you mostly the benefits of these robotics compared to traditional therapy. Now, before we start on that, I would like to address very quickly the current situation in the region. So I will show you a map of most of Europe. And here we can very clearly see all the points are actually hospitals or clinics who already implemented these robotic devices in their therapeutical settings. So it's not all the entire collection of robotics around, but every hospital or clinic has one or more of these devices in their settings. And it's quite clear that these devices are already well established in Western Europe area. Now, if you look more towards the Balkan countries, we can see that these numbers drastically decline. And this, of course, would be a pity that these countries would fall behind in this rehabilitation sector, especially this robotic rehabilitation world. So actually, the problem we encounter is that we keep having more and more therapy demands while we have a problem to follow with the therapy resources. Because of a change in demographics, we have more elderly population. Because of an increase in general healthcare systems, we get more stroke survivors, better pharmaceuticals, etc. So we get more and more therapy demands, but we do have limitations with our therapy resources. We don't have enough therapists. We only have a limited time to treat our patients. And this is something we should try to counter to try and bring the best possible care for our patients. Now, this robotics is one of the things we can use to try and bring balance between this demand and these resources. So I will guide you through the scientific and clinical guidelines of therapy efficiency. The more efficient my therapy will be, both for me, both for my patient, but also for the hospital management, the better care we can provide for our patients. So let's start. The first one, start as early as possible. This is widely accepted. The earlier you start with your rehabilitation with your patient, the more or better results you can achieve. Already here, I find a lot of limitations for me as a therapist if I see my patient for the first time. So in general, most of these patients will be bound to their bed. And if I go there as a therapist by myself, it's very difficult to get them the best treatment possible, because treatment will mostly exist in most hospitals on passive mobilization, positioning, etc. Now, if we see with these robotics, already from a very early stage, people or the very severe patients with functional ambulation category of even 0, can already be treated with devices like Erigo and Locomat. So again, the earlier you start, the better. We see the same thing with upper extremity rehabilitation. There are already robots with even patients with a manual muscle testing score of 0, which basically means no movement at all possible in the arm, can already be treated with these robotics. We want to train functionally. Now, this is a very important part, of course. We don't train our patients, just give them exercises without knowing what we're going for. So we have to consider our patient's goals, of course our therapist's goals, and make sure they align and they're possible. Now, these robotics are all very well equipped to train functional exercises, functional tasks, functional movements, and to work towards an improvement in the patient's activities of daily living. Now, again, this is something we heard earlier today, that some therapists might be scared that these robotics will take over their jobs. Now, this is absolutely, completely not true, because these robots, no matter how good they are, they're still robots. They're still computers. They're still only ones and zeros. So they're quite dumb. They're only as good as a therapist who's operating them. So that's why we heard already before today, we need to have experts. We need to make these therapists experts to know how to work with these robotics. And the better the therapist, this is also for traditional therapy the case, the better the therapist, the better outcome you could expect for your patients. Exactly the same with robotics. There's more possibilities towards this functionality. Intensity matters. So we need many repetitions, a high effort. Most of you might know that in therapy, we always work towards brain plasticity, neuroplasticity. We want to work on the innate capabilities of the brain to heal itself, to reorganize itself. And one of the reasons, or one of the actions we have to take is many repetitions. So I will show you two videos. This is actually the same patient on the same day, a woman who suffered a stroke. On the first video, we already see that this is not very therapy efficient. The patient needs first a walking aid. We need two therapists, one to hold the patient up for patient safety, so she doesn't fall. And the second one moves the leg. Again, this is not a very smooth physiological movement. This is very slow. We will not get a lot of repetitions this way. Also for the therapists, no matter how good of a job she tries to do, this is not a very ergonomical way of working. So there's a danger, of course, for this therapist to maybe get back problems or shoulder problems. Also, this will be very exhausting. I know this kind of therapy, if I have to do this for 30 minutes for my patient, I will not be able to keep this up. That's only 30 minutes. I still have an entire day to go. I have more patients. So if we could use a locomat, for example, in these therapies, this is actually considering a couple of therapists inside the robot who help me in my therapy. So we saw the movement is a lot smoother, a lot faster. We get a lot more repetitions, and I need a lot less help from my colleagues, therapists, a lot less effort for me myself. So that's why it's a very useful tool, of course, to give bigger intensity towards or during your treatments. We have to provide feedback. This is also used in traditional therapy, of course. Now, in this case, it's mostly verbal feedback that's used. Therapists are very inventive in this. They will help the patient. They want the patient to improve. But just there's only so much feedback you can give. Now, if we use these robotics, we also have games we could play, augmented feedback. So actually, during the exercise, we also get a visual feedback immediately during the task the patient has to perform, and also afterwards. This actually helps to give meaning to an exercise, to a task. Let's say, so again, this is important for the brain. The brain has to give a meaning to a movement, otherwise it's just a movement. I could ask my patient to lift their arm up and down 1,000 times. Again, this is not bad. This is still training. This is still therapy, but it's just moving your arm up and down. Now, if you work, again, previous guideline functionality, if you use a functional movement and the patient has to follow or has to reach a certain angle to grab an object, for example, the first session and the first exercise, move their arm 90 degrees, catch an object, the second one 45 degrees, and then they can immediately see if they overshoot it, for example, and get immediate feedback, so it's easier for the brain to give meaning to this task. We want to train beyond our patient's present capabilities. So this is quite normal. If I know my patient, I know what my patient can and cannot do. If I only train exercise which my patient is able to do, then he will not improve. He will become better at what he already can, but he will not improve, and we want to get a better outcome. So there are a couple of things, of course, we want to train, and we want to keep challenging our patients. That's actually the bottom line, the most important part. And the difficulty in traditional therapy is if I have my patient, it's very hard for me to see how much assistance should I give my patient, how much support should I give my patient. again, this will not always be the same. I will have changes because I'm only human. I'm not working like a robot, so it's very difficult to get the correct support and assistance. So with this robotics, it's very easy to increase the difficulty of exercises, for example. If we notice that our patient has a maximum score on exercise, we would know, okay, this might be too easy. Let's make it more difficult. Let's challenge our patient. We can increase the range of motion. If our patient, we know, can move their arm up to 45 degrees, let's go to 50, 55, 60 degrees, either with or without robotic support or assistance. Again, challenge your patient. We could decrease our robotic support or robotic assistance, actually. Again, make it more difficult and challenge them. We could also, in case of gait rehabilitation, decrease the body weight support, or in case of upper extremity rehabilitation, we can decrease the arm weight support. Again, the most important part, we challenge our patients to train outside of their comfort zone and try to achieve a bigger movement, better control than they already have. The last one, we want to ensure an active participation and motivation. This is, of course, also very important. If your patient is not motivated, they think they will not or cannot get better, why should they spend their time for therapy? Why can't they just go home and watch TV and relax? So in general, most therapists I know or I have seen, they're always pushing their patients. They're always motivating them. They want them to become better and really try to motivate them that way. There are some other things we can use while using this robotics. So first, we have very detailed patient reports. This is also part with the feedback, so we can show their results immediately after one exercise. We could show them after a therapy session, or even after a longer period of time, let's say after a couple of months. If you can show your patient they're improving, they know they're getting better, they will get more motivated. I already talked about the games we play. The games are a lot more fun, especially now there's a lot of variety in these games. If you have to do your same exercise every day, so every day the same exercise, this will get boring quite soon. If you have different exercises, and especially if you can get your scores and you can try to work towards a higher score, a new best score, this is also very motivating. A lot of clinics already, so this is already mentioned today also, so depending on the setting. So I'm also a big fan of Itero, the room we are in, that it's very open. The patients see each other working together, working with the therapist. If you see someone working harder, they're all in the same situation and they all want to get better, but also wish for other patients to get better. So that's also very motivating to see, and actually sometimes very beautiful to see how they support each other. So let's quickly summarize the benefits of these robotics that can be used in rehabilitation. First, I have again a small video to really see the differences. So in this case, we do have a lot of repetitions. Again, this is very good. But the problem again on the left video, we have three therapists. This is very exhausting. Again, not very ergonomical, and it's very hard to keep up. Not very efficient, both for the therapist, the patients, but also for the hospital management. Then the video on the right, we see actually one therapist controlling two work mats at the same time. So the first patient is set up, starts his exercises, starts walking, and the second patient comes in, and we do the same. The therapist can walk between the two devices and help where necessary. Change the support, change the assistance, motivate them. And this is a lot more therapy efficient. So first of all, very important one, less physical strain on the therapist. So less chances that the therapist will actually fall out of your group because of a sick leave, for example, with back problems, shoulder problems, etc. We can have longer therapy sessions, both on the side of the therapist. It's less exhausting, again, less strain, but also on the side of the patient. If the patient gets tired during normal traditional therapy, we maybe should give them some rest and stop the therapy. If they're too tired, stop the therapy for the day. With these robotics, we can try to maybe make it a little easier so we don't have to stop the exercises, we can keep continuing longer sessions. This will, of course, increase the intensity and we have more repetitions, which in its turn will actually work towards this brain plasticity. Fewer therapists are needed. Again, this will not mean that therapists will lose their job because of these robotics. But let's say instead of 3 therapists working on one patient, you have one therapist who can work with 2 patients at the same time. In the meantime, the other therapists are free to work with other patients. So for hospital management, this is something you can treat or train a lot more patients than before. We have very physiological trainings that we can adjust. Again, the robots are only as smart as a therapist who's using them. We have the performance, the augmented performance feedback. So again, give meaning, get the visual feedback and give meaning, give the brain meaning towards the tasks you're doing. And it's very fun and motivating to play with these exercises, to work with these robotics and so on. So actually, what we try to bring, we actually try to bring balance with these robotic devices. So if we will get more resources and try to use that to actually counter the therapy demands. With that, I thank you.
Thank you very much, Mr. Mariën.